What's going on, everyone? Happy Friday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Friday edition of the Pandemic Update for Friday, July 12th, 2024. If you're new to my channel, this is where we do the daily pandemic update on all things COVID and any other virus that could be a health threat to you. Let's face it, there are a lot of different viruses out there, and each of them carry a various different health risk. COVID, it can go on to become long COVID if you don't recover right away. Whooping cough, H5N1. There's a lot of different viruses out there. You need to know what's going on with each of these viruses, and you need a daily update. That's where I come into play. I give you the daily update on what's going on with these viruses. So if you're new to my channel, subscribe down below. Give this video a thumbs up. The more people that hit that like button, the more YouTube will push this content throughout the algorithm. So hit that like button. Let's try for 200 like button hits today. Share these videos with anyone you know. Hit that notification bell. And if you have anything to say, maybe it is you tested positive, leave a comment down below. And of course, if you clicked on this video because you did just test positive, once again, I really hope you have a full and speedy recovery. Alrighty, we have yet again another very busy news day, and it is Friday, which means we do get CDC data. We're going to take a look at some of it today, and then some of it we are going to actually save for tomorrow because it would go way over 20 minutes today if we looked at everything. Alright, starting off with the news. San Diego County in California boost free COVID testing with positive test results on the rise. So cases have rose enough in San Diego that people can now go out and get free COVID tests. It's a good thing that they brought that back once again. Rod Argent, you know, the music group The Zombies. Maybe you're from before my time. Maybe you grew up listening to them. You know, rock and roll music back in the 60s, 70s. Apparently they're still together. Well, Rod Argent retires from touring after he has had a stroke. Rod still firmly intends to continue his other creative joy of writing and recording with the Zombies, the group's managers said in a statement. So he is retiring after sadly having a stroke. Alrighty, someone else who is having health problems right now. Johnny Greenwood, who is a member of not only Radiohead, but also his side project called The Smile. It says here, a few days ago, Johnny became seriously ill from an infection that needed emergency hospital treatment, some of it in intensive care. Mercifully, he is now out of danger and will soon return home, but they have to cancel all engagements. So his tours with The Smile and anything with Radiohead, unfortunately, they are canceled right now, and he will be sidelined for some time. And this is coming from his medical team that says, hey, he needs time to rest and get better from whatever this illness is that he is dealing with. All right, The WHO says COVID still kills 1,700 people a week around the world. And we know this is likely a huge undercount. Just the United States alone, we're doing over 400 deaths each and every week still. So for it to only be 1,700 among all the countries, with many countries currently doing increasing numbers of deaths, the real number, it's probably well over 2,000, maybe closer to 3,000. We will never know what the real number is because some countries, the data is so sketchy. Some people are not being diagnosed with COVID at death, testing with the way, just with the way things are here in 2024, 4 years after 2020. We know that the number is likely higher, but hey, still, 1,700 people a week, that's still quite the number. So we're still losing far too many people to COVID. Moving on now to our next story, pertussis, whooping cough. It's a problem here in the United States, and it continues to grow at this time. And America's pertussis wave is continuing to grow with 215 cases reported in the last week from the CDC. This is the most whooping cough reported, cases of whooping cough reported in a single week in years. And year-to-date cases now more than 3 times larger this year versus last year. Wow, that is a lot of whooping cough cases. That is really concerning. Now to a new study that is out today. Nearly 1 in 10 pregnant people who get COVID will develop long COVID, a study finds. So, yes, 1 in 10 people who are pregnant do go on to develop long COVID. That is not a good thing whatsoever. And moving on to yet another story. And this one is a story that's been evolving for all 4 years of the pandemic. Well, now, I shouldn't say all 4 years, since 2022. Whoopi Goldberg, back in 2022, back in January 2022, tested positive for COVID. Whoopi Goldberg, on November 14th of 2022, tested positive for COVID a second time. Whoopi Goldberg, in September of 2023, right as The View was getting ready to start their new season, tested positive for COVID a third time. Well, get this. As of July 11th, 2024, Whoopi Goldberg has tested positive for COVID yet again. This is now her fourth case of COVID. Her last case was back in September 2023 when she missed the season opening of The View. So we'll have to see what happens here. I mean, 4 times now for Whoopi Goldberg and COVID. Moving on to this. In the UK, 9 babies die of whooping cough as cases triple. There were 2,591 cases of this disease, also known as pertussis, in May, which is 3 times the number seen in 2023. So whooping cough, hey, it's a problem over in the UK as well. All right, let's take a look at the UK a little bit more for just a moment in terms of COVID. And you can see here on the chart, COVID is rising. Take a look at this. Hospital admissions. You can see they have been rising as well. And we also see here that the number of people in the hospital, it says daily count of confirmed COVID-19 patients in hospital as of 8 a.m. And take a look at this. Wow, that number's been going up. The good news is their cases have peaked and they are starting to drop. So with that, you can see here the cases and positivity rate are starting to drop. We do know hospitalizations lag. So pretty soon down the line, they will start to drop, which would be some welcomed news for the UK. Taking a look now in the United States at the latest allergy map, 57% of the country is in low to medium status. And I do have some good news about this. Oregon, the orange area, got much smaller today. Same with Washington. Yes, there's some yellow in the west and portions of the plains, but hey, the orange, it's very limited today. That's a good thing. A lot of green on the east. That's because of rain that's happening along the coastal areas. Northeast, there is some yellow today. Taking a look at what's going on with air quality values, some improvement in the east for today, or there was some improvement as of earlier along the immediate coast, but take a look here. There's a cold front right along the immediate coast. Directly west of that, forget about it. There's a lot of yellow going on around the country. We do have wildfires confirmed in Oregon now. California's been having problems. Canada's having problems. And you can see here some of that air quality does seep into the country. And also west of that front, it's not all cool. No. It's not cool. There's a lot of hot air. So there's a lot of reasons why the air quality is bad. And unfortunately, it's going to stay like this for some time. And it may eventually push into the immediate coast of the east and the northeast as well. The vast majority of the country is doing bad for air qualities right now. Taking a look at the latest heat-related illness map, they continue to increase around much of the country, and that's going to last right into next week. We do expect it to continue. It's going to be very hot in the east next week. If you want to learn more about climate and weather, you can do so over on my other Twitter or X account, Climate Data Report. No, we're not talking about the other YouTube channel today. I haven't had time to post on it this week. Hopefully, maybe I'll get at least maybe a weekly video out of there. I did, actually, no, we did post something there the other day, but we just haven't had much time this week. Philadelphia, yesterday, reported 838 EMS incidents, and yes, see this picture here. There was a devastating fire in the northeast section of the city yesterday. I read something like 150 firefighters or 140 firefighters responded to that. Yeah, really sad. Taking a look at this. This is Wastewater for Philadelphia, and it did finally update today. The northeast section of the city is now starting to see a rise for COVID and wastewater. The rest of the city is not seeing that just yet, but the northeast section of the city, anywhere which would be, if you're from Philadelphia, you watch my videos, north of Lehigh Avenue, yeah, that would be starting to see a rise. And I don't know where actually the cutoff is for the Northeast in the wastewater treatment plants, but the Southeast and the Southwest are not seeing those rises yet. Southeast Pennsylvania, it has been a very busy afternoon. Not so much for Montgomery County, though I am seeing Lower Providence Township cardiac arrest. That's not a good thing. But let's take a look at Chester County. Before we do the live look at Chester County, here's Chester County from just over, just about an hour and a half ago, almost 2 hours ago. Yeah, look at this. There were multiple sick person calls in Chester County earlier. This is not good whatsoever. Take a look at all these calls. Let's do the live looking. Here we are, hour and a half, almost 2 hours later. Yeah, very busy in Chester County. And not only are we seeing multiple sick calls, we're seeing multiple stroke calls. Yeah, post 4th of July illnesses. Yeah, they're starting to rise in Pennsylvania, at least here. I still can't say the same for COVID because of what's going on in COVID wastewater, but I think that's going to be changing very soon, just based on the number of sick calls. I'm seeing tweets in Southeast Pennsylvania, people saying they know a lot of people with COVID right now, so I think the ball is starting to roll in Pennsylvania and the Northeast, though it's not showing up in wastewater data just yet. All right, the national positivity rate for COVID, 39.6%. The prior week was 36.5%. That's a difference of up 3%. Now let's take a look at what's going on with wastewater across the United States. We're just going to look at a couple things here. And we do know two things that are not good at all. Look at the number of blue sites. These dark blue sites, 0 to 19%. That dropped by 14%. There's only 155 now. Look at the number of orange sites, 240. Look at the number of red sites, 80 to 100% COVID increase detected, 120 sites. You add all that up, it does now show this on the CDC's wastewater data. The national wastewater level for COVID from the CDC in the United States is now high. So this summer wave, it is meaning business. The West Coast is high, the South is high, the Midwest and the Northeast are starting to get the ball rolling. Yes, this wave is starting to take off. And you can see that here. You're starting to see some more high levels starting to show up in Northeast Pennsylvania. See, Pennsylvania has now turned a corner, at least on CDC page, for showing high. And I think the Pennsylvania dashboard, I think next week we're going to start to see increases. If we don't, I would just assume something's wrong at that point because I'm seeing so many people say, just tested positive for COVID, just tested positive for COVID. Texas is very high in Nevada, very high in Oregon, high in Alaska, not very high in Hawaii anymore, just high. And Florida is the darkest shade of blue for very high. You have very high in Arkansas. You also have very high in Maryland. More on wastewater as we go through into the weekend, taking a look at the variant update for the United States. And we do see it did not update today, but KP.3 is at 24.5%, KP.2 is 21.5%, LB.1 is now at 10%. And I did take note of something today. Let's just click on a random region. Let's say the Northeast, Connecticut. Look at this. Look at this. It'll eventually come up. We can now go region by region once again with the CDC Nowcast. Yes, because for an unfortunate reason. It's because so many people are testing positive. There's probably enough data now that, well, hey, once again, we can start sequencing by region, and the majority of the regions are showing. We'll look deeper into this into the weekend, but take a look at this. In the Northeast, KP.3 is not leaning away. It's the KP.2 variant that's at 36.6%. LB.1 is at 26.7%. We'll try and take a look at all the regions maybe tomorrow, although we do have to take a look at the ER statuses tomorrow as well. All right, moving on. Taking a look at what's going on with the ERs, by the way. Emergency department visits, they're starting to rise in the majority of the country. You only have North Dakota, Wyoming, and Washington, which are dropping at this time, and there are some states that are stable, but Pennsylvania, as you can see, once again, substantial increase, Illinois, substantial increase, Texas, substantial increase, Florida, and substantial increase. There's a lot of states with a substantial increase at this time. Let's just take a look real quickly at the national ER levels, and then tomorrow we will take a look at what is going on. We'll go through all those states. You can see nationally, ER levels, they did continue to rise this week, and it is now up these are people diagnosed with COVID. So they're coming to the ER, they're COVID positive. 7-day moving average is now 1.40% of all people coming to the emergency room are diagnosed with COVID. Take a look at this. Oh yeah, epidemic status. It's growing. It's growing in a lot of states, the majority of states, and it's likely growing in quite a few states as well. Stable and uncertain, only just in a few states, and not estimated in just a few states. So we are in the middle of a major summer wave right now. As you can see here, it's picking up the pace everywhere. 4th of July. If it did anything to the COVID wave, it's being shown now. And it's already showing up. Some say, oh, you got to wait a couple weeks. Yes, some of this data is lagged behind, but the only thing that we'll probably see happen is things continue to rise again next week. So, yes, 4th of July did leave its mark on this current COVID wave. And let's briefly take a look at the influenza map. And we can see here, not much talk about that. It's summertime. Influenza, regular, flu. It's not doing that bad at this time. Taking a look at what's going on with New Jersey, yet again, you're going to see here, we do have a completely different New Jersey number. In New Jersey, 257 hospitalizations are reported, with 70 out of 70 hospitals reporting. Let's zoom this in. Remember the other day, it was for some reason, it was over 300, well over 300. Now today it's this, yesterday, what was it? It was a very low number yesterday. I don't know what's going on with New Jersey. 11 people on a ventilator, 28 people in the ICU, and 35 discharges. So yet again, New Jersey's data is just an absolute mess right now. Every day is a completely different number, and sometimes it's hundreds of hospitalizations different than the previous day. I don't truly understand it. If anyone knows what's going on there, let me know down below. All right, New York State today tested positive 1,920 new cases. Again, they have been continuing to steadily climb throughout the summer. We're not seeing that rate increase because of 4th of July yet. New York, it probably wouldn't show up till next week, and that's probably the most cases everywhere. What we're seeing now, we're just seeing the wave. It was just picking up the pace leading into 4th of July, and hey, we're just seeing it now. Hospitalizations in New York State. 994 people have been hospitalized. 83 people in the ICU at this time. I do suspect next week it'll probably go back over 1,000 once again and continue from there. The number we have to watch out for is 1,711 was the peak of the summer wave last year. And believe it or not, that actually did not occur. Their highest level of this particular time frame for a wave actually did not occur till October 2nd. Then they dropped until the winter wave started right before Thanksgiving. So we'll have to see. Will they get higher than 1,711 hospitalizations by the end of this wave? I'm hoping they don't, but only time will tell. We still have July and a hopeful peak at some point in August. Some are even saying the peak may not be till September. We'll just have to wait and see what happens. Taking a look now at what's going on in Los Angeles this week. Speaking of peaking, Los Angeles, we hope to see a peak for you relatively soon. Right now, cases are continuing to have a steady trip upward, and your daily average is now up to 330 cases. Testing positivity rate is now 10.12%. Wastewater has gone upward. Emergency department visits have gone upward. And hospitalizations continue to rise as well. You now have 240 people in hospital. Hey, 240 people, when you have millions of people that live in your city, yeah, that's not bad, but once again, we know numbers are likely an undercount, and this is a summer wave at this time. And deaths, unfortunately, they are starting to rise a little bit. You're now averaging close to 1.5 deaths per day. California, take a look at the COVID positivity rate in California. 13% test positivity rate this week, up 3.9% from last week. That is a big increase. COVID deaths, yeah, they have gone up slightly as well. 1.4% of deaths due to COVID-19 in the past week, so that has gone up. And interestingly enough, your influenza positivity rate has gone up by 1.1% to 3.4%. And influenza deaths, doesn't look like you're seeing any at this point in time. But once again, that COVID positivity rate, 13%, up by 3.9% in the last week, that is concerning. And the only hope would be with an increase this fast. Usually when you start seeing increases this fast, that's usually a sign that the peak could be coming soon. So we hope. Alrighty, folks, that does it for the Friday edition of the Pandemic Update. We will have another pandemic update again tomorrow, probably a midday update tomorrow. I know today we're relatively late. I already got a lot of things planned. Emergency department visits. We are going to take a look at a forecast model, and we're going to hopefully go region by region with that data from the CDC in terms of variants. You're going to be really surprised. The variants, they really are different from region to region. If you enjoyed this update, give it a thumbs up, subscribe down below, hit the notification bell, share this with anyone you know, and of course, leave your comments down below. I will see you all again next time. Until I see you again next time, stay safe, everyone, and have a fantastic Friday evening. Thanks for watching.